Hello, this is Dr. Gay from First Look MRI, and this is a young overhead throwing athlete, a pitcher, and they had pain in their elbow, they had a partial tear of their UCL, and they also had shoulder pain. And on their shoulder here we see an axial image, and the thing that stands out most is right back here. This is the posterior superior humeral head, right at the infraspinatus tendon insertion. We see these moderate enthesopathic cystic changes, and in a young overhead throwing athlete, when we see that, next place to look is in the posterior superior labrum. And sure enough, this is the biceps labral anchor right here. You see the biceps coming out over here, and posterior to that right here we see a little tear of the posterior superior labrum. So this looks like an example of internal impingement. So these patients are overhead throwing athletes sometimes. They can be a javelin thrower, or they can throw football, they can throw baseball typically, but anything with overhead throwing or jobs where they have to lift their arm up and outwards repetitively, they get the classic appearance of erosion, enthesopathic erosions, and then this labral tear, the posterior superior glenoid. So just think of these two things going together. And when the humeral head is rotated backwards and externally rotated and abducted, this part of the bone digs into this part of the labrum, and you can get this labral tear in this classic location. Now this patient also had some atrophy and edema of the muscle, which I had not seen before, but this is the infraspinatus muscle. It's a little bit atrophic and also edema within that. And so that may be from chronic distractive forces and muscle strain or myositis. There was no ganglion cyst to make you think of neurogenic impingement. And they also had a little bit of bursitis, a little bit of bursal fluid there. So a case of internal impingement of the right shoulder in an overhead throwing athlete. Thank you very much.